Hi, I'm Sarah Lussier. I'm a menopause health mediator and strategist with Accountable Menopause Health Strategies. Welcome to my YouTube channel. So I love to talk about anything women's health, but specifically around this time of transitioning to menopause. And sometimes for some women that can start as early as our late 30s or what's called the late reproductive cycle. And that's a very little known fact in medicine or in clinical practice. So chances are, if you're in your late 30s or in your early 40s and you're starting to experience, quality of life change symptoms. So quality of life changing symptoms like your sleep is off, or you're starting to gain weight around your middle, you're starting to experience itchiness or skin issues. Maybe, your periods are starting to be heavier or a little bit shorter or more regular or less regular. Just small changes like that to your cycle, but not really largely noticeable. Chances are, if you go see your doctor, they're going to say, well, if you're still getting a regular period, you're not really in perimenopause. And so the treatments that are typically used for hormonal shifts during your menopause transition years or postmenopause are not going to be made available to you. And so you might feel unheard, you might feel unvalidated, you might feel dismissed, you might feel there's something wrong with you, when in actual fact, you're normal and everything that you're experiencing is common. It doesn't mean that it's normal and that you have to suffer through. There is help, there is information out there, but in that lack of clinical expertise and support, women are often felt left like they have to fend for themselves, look for the information themselves, Google their symptoms, follow these TikTok shorts or YouTube channels, or with health and wellness experts, and some of them may be experts, and even just like this one, but it's hard to know what is true and what is not, what claims are valid and what claims are not. I think that the majority of women haven't necessarily learned the skills to be able to evaluate what is good medical information and what is not. How do you make sure that a statement is supported? How do you make sure that what somebody says is true and has been supported in the literature and maybe supported by clinical trials or not? So that kind of information can get a little bit unwieldy, and a lot of people are scared off by the level of detail and scientific expertise or knowledge required or training required, when the truth is that there are some very simple tips that can help detect whether something is maybe a little bit off or if something is evidential. And so that's what I want to do in this channel, is to empower women to be able to gain those skills so that they can feel confident in finding information that can work for their bodies, connecting with their intuition, and really trust themselves to speak up and really seek the care that they need, whether that's with the help of a healthcare provider, seeking some medical treatments, or whether that's just seeking support through lifestyle changes and supplements and herbal therapies, or self-care things like meditation and stress management technique. There's so many things that you can do for yourself, even before looking for the support of a healthcare provider. And so what I hope to do is be able to bring some tools and tips to help you understand and weigh the pros and cons of various methods and finding the right ones that work for you. So I hope that you subscribe, and I'll catch you next time.